Hey guys, how's it going? I'm Dr. Alvarez with Endobariatric.com and welcome to another episode of our FAQ section. And today I want to address energy levels right after your surgery. So it is very common that right after surgery you may feel a low energy level. And you need to understand that, number one, it doesn't happen to everybody. Number two, you're recovering from a major surgery. Remember that this is major surgery. You're getting a big chunk of stomach out of your abdominal cavity, even though we do minimize this because it's done through mini-invasive surgery, and it's very tiny incisions that creates the aspect of being a small surgery, even though it's a major surgery. But with the tiny incisions, the mini-invasive surgery, with laparoscopic surgery, nowadays modern medicine, you bounce right back up 2-3 hours after surgery. Patients are getting up to the restroom, moving around, and patients recover very, very fast. But still, you had a big surgery inside. So the message is, have patience. Number one, don't be cutting down on carbs right after surgery, because a lot of patients feel the need to get the most out of it. I mean, I want to lose a lot of weight. Yes, but it's not the moment right after surgery. Right after surgery, I want you to recover from surgery. Once your sleeve has healed, once you feel your old self again, then you lower your carb intake, then you look into counting carbs, then you look into the amount of sugar you're intaking and stuff like that. Right after surgery, you need the sugar, you need the carbs, because you need a good energy level. Notice I did not mention protein intake, because I'm not worried about the protein, because your body has enough reserves for the next few weeks. I am worried about two things, especially those first 7 to 10 days. Number one is fluid intake. I want you well hydrated. And the best way is to look at the color of the urine. If it's turning a little darker, you're falling behind, you got to push it a little bit more. That's number one. Number two is sugar or carb intake, because this is your fuel. This is what's going to push you or give you the energy for the next few days right after your surgery. So trust the process, be patient, because everything goes away. This is expected, again, because you're recovering from a major surgery. So be patient, follow your doctor's guidelines, because he or she will give you the indications or instructions to keep you right on track. And that's what we strive for. We want you to heal well. We want you to feel the least uncomfortable possible, and that is why our guidelines exist. So follow your doctor's guidelines, touch base with your doctor, and if you have any questions, because as I tell my patients, I prefer you email me and we clear out absolutely any doubt that you may have, but you're still right on track, and that's what we want. So I hope this makes sense. Be patient, follow your doctor's guidelines, fluid intake, a little bit of carb consumption, and you'll be just fine. I hope you recover fast from your surgery, and you know where to reach out to us. I mean, social media, through my personal Instagram that I personally manage, and I'm Dr. Alvarez with Endobariatric.com, where we are changing lives, yes indeed, one sleeve at a time. Take care and God bless.